I am Dr. Susan Hickman. I'm a professor in the IU School of Nursing. I also co-direct the RESPECT Center, the Research in Palliative and End-of-Life Communication and Training Center at IUPUI. My research focuses on end-of-life decision-making and communication. Advanced care planning is especially important for people near the end of life because they often face a lot of really difficult decisions about what kinds of treatments they do and don't want. Healthcare providers often don't take the time to talk with people about these decisions. Instead, people get swept up in what we call a decision cascade, where one treatment goes to the next, and there's no time to really stop and think about the big picture. It's important to ask patients, how can we create a plan of care that actually allows us to meet your own goals? My research specifically focuses on a tool called the POST, or Physician Orders for Scope of Treatment. This is a communication tool that healthcare providers use to communicate with each other about what the patient's values and goals are. People who have received a life-limiting or life-threatening diagnosis are often faced with a lot of really difficult decisions, and it can be really confusing and hard to make these decisions by yourself. Additionally, when you're having these kinds of conversations, it's really important to think about who you are as a person, what gives life meaning to you, what's important. Ideally, you can then make decisions about treatments in a way that fits those values and goals. My training is as a clinical psychologist, and as a matter of fact, I'm a geriatric psychologist, but I have worked closely with nurses throughout my entire career. And the reason is pretty simple. Nurses play an essential role in providing care to people near the end of life. I've greatly enjoyed my collaborations with my nursing colleagues, and I feel really honored to be a professor in the School of Nursing at IU.